Well, good morning, everybody. Continuing with our Medical Monday, we are going to visit with a special guest here in the studio. We're going to talk with Dr. Dante Beretta, and a family physician here, CHI St. Joseph's Health Primary Care Clinic. Welcome to the airways.
Thank you.
Talk about some of the things that you work with and help in the CHI St. Joseph's Health Primary Care Clinic. When did you move to the area? How long you been here?
Well, we moved to the area about 4 years ago, but I started practice here 2 years ago. So
yeah, and you were telling me you were Virgin Islands, so you were hanging out down there.
Yep, that's
you
where
came back?
I grew up, the U.S. Virgin Islands, and we made our way up to Minnesota.
And made your way to the winters up here.
That's right.
It's a good one, wasn't it? What a shock.
Yes.
Yeah, well, no doubt about it. So we're happy to have you here in our community and doing great things, and keeping our community healthy is the biggest thing. And could you tell me a little bit about yourself and your family medicine physician you practice and what you do and you specializing in?
So I'm married. I've got 3 kids.
Mm-hmm.
We have been here in this area my wife is originally from Nimrod.
So we've got some roots there. That's good.
Yeah.
Coming back home.
And then kind of getting into family medicine. I just knew that when I was a kid that I always wanted to do something with science.
Mm-hmm.
And this is a good way of mixing both science and working with people. From there, I went to college and came up to Minnesota, St. John's University.
Mm-hmm. Good one.
That's where I met my wife.
Mm-hmm.
And then went to Chicago to do medical school. And there's where I kind of figured out that I liked a little bit of everything. Mm-hmm. So I wanted to kind of do the family medicine was really the way to go for me.
Yeah.
And then I did a further 3-year training for family medicine in Pennsylvania where I had relatives. Then we came back here.
So talking about family medicine, and so important to have it. I mean, I think it's kind of a catch-all. Bring the family in, help send them on to the right specialist, whatever it might be. Kind of grabbing it all and having a wide variety of knowledge about all of the things that take care. And at CHI St. Joseph's Health Primary Care, I'm guessing that often you're the first doctor a lot of people see, or consistently see for preventative care and things like that.
Yes, I mean, that is kind of the place to start.
Mm-hmm.
And we can do a lot with primary care, the prevention aspect of it, and just treating a number of things that are sometimes more common, sometimes more of the complex things. And we have the knowledge and the ability and the backup to kind of handle a lot of different things, great variety, and able to
kind of assess and analyze and then turn around and then send them to specialists. And,
yep.
I kind of look at too often, you see that the family physician and then if there's some specialties, sometimes they have a little specialties they know and they can, do the treatment, and that they have the ability to assess, make the diagnosis, or at least say, hey, this might be it. We need to get you to this specialist and that. But you also get to see the whole family. A lot of times you get to see mom, dad, and the kids, and that's got to be very rewarding.
That is quite rewarding. Yeah. I've had families where I've seen everybody from the great-grandmother to the grandmother to the parents to the children. So that's an
rewarding.
Awesome thing.
Well, and then you can start to see some of the hereditary things that might be going on as you see generation to generation, and also help. So as a family medicine physician, you treat patients of all ages, like you just said, from infants to seniors, do it all, but take the next step. Hey, you need to see this specialist. Here's what's going on. Kind of assessing and analyzing, isn't it?
It is. And that's part of the challenge, and that's part of the fun of the job. Mm-hmm. But it really is nice to be able to help deal with most of what somebody needs, but also to be able to get them to the appropriate higher level of care when needed.
Big net of knowledge you have to know too, isn't it?
Yeah, that's why we do the schooling for that many years, and there are things that we do to keep up with things, what we call CME, continuing medical education. Mm-hmm. And it really is a broad range of things that we need to know a little about everything.
Is there anything specifically you really got, everyone has their interest, in certain things, and family medicine, anything especially that you have a huge passion for? Or?
I've had passion for things that are in the preventative aspect of care, just figuring out what can we find out about and what can we help to look at preventing and to help to find things early. I've done a lot of work with folks who have diabetes
That's pretty common.
Yeah.
And I think that's the key thing is in just visiting with you and at CHI St. Joseph's Health Primary Care Clinic, having a family physician kind of have a couple specialties, and you're saying preventative, putting them on the right health path, and then having some knowledge about diabetes is very common to have the need for that in our community, and just simple things that they should do to help them with their preventative care to keep them healthy. You see it at all ages, don't you?
We do.
Yeah,
Definitely do.
No doubt. So let's talk a little bit about our community and our patient care. What do you enjoy the most about practicing medicine in our community here? I mean, you must see, quite a bit. It's busy. There's no shortage. We need doctors and more just like you.
There's a number of things that I enjoy about this community, but I have to really say the people.
Mm-hmm.
They're just down to earth. They tell it like it is, and they're just kind.
Yeah.
I think it's been a really good thing that I found here in this area.
So Minnesota Nice is real, I would say.
Minnesota Nice is real,
Yeah.
and it's a different flavor here in the rural area.
Yeah,
I was previously at a practice in the Twin Cities, and
Mm-hmm.
there's definitely a difference that you recognize. So that's probably one of the biggest things about the draw here.
Oh, that's cool.
But I also have to say that the setting, being out here, this area is just beautiful. I just even on the drive in today,
Mm-hmm.
it really is just amazing. The wildlife that you see and the trails and the things that we can do, the surrounding lakes. This is just the whole package.
Yeah, there's no limit to activities people can do to keep themselves healthy too and get outdoors and enjoy that. But I think also in addition to your Minnesota Nice, I mean, they're pretty direct. Hey, Doc, let's get to this, right? What about this? I mean, they're pretty direct still here. I mean, if you
That's
notice
true.
that, is that up in this area?
And I think that it's interesting, even though they may not agree.
Mm-hmm.
They will listen, and I can tell them this is what I think is the best way. But I think that they're also open and honest and saying, no, I can't do this. Do you have something else that we can do? And that's one of the things I like to be able to work with people. So if you find that something doesn't quite fit for you, there always is some other option. And at least if I feel the person understands what's going on,
Mm-hmm.
it's nice, as opposed to them saying, "Oh, yep, I'll do that," and they turn around and not.
Yeah,
I don't see that around here as much.
We're visiting with Dante Beretta, Dr. Dante Beretta here for CHI St. Joseph's Health Primary Care Clinic, and going to that point is if they're not going to do it, then it's not going to be preventative. It's not going to help them. So being able to assess that and say, no, I mean, I think pretty people, no, I don't want to do that. I can't do that. It doesn't work for me. I mean, finding that solution for them so that they actually take the medicine or make the steps is important.
And I think that if you lay the groundwork, they may say, no, not at this time. But who knows? In 6 months, they may agree to it. So I've kind of looked at that as being an important thing as far as that ongoing relationship with somebody. They understand where you're coming from, and you understand where they're coming from, and
Yeah, and I think in your community and your patient care, building that strong relationship with your patients is key to family medicine. I mean, that's the trust, building the relationship, and knowing about the patient, and also them having a comfort level and having that relationship to make that change is important. What's one piece of advice, generally speaking, that you often find yourself giving your patients regarding their health?
I think that there's a lot of things, but tends to be a lot of things to diet and exercise. And one of the things that I tell people is that you really can make small changes that will help. And you may not notice, you may not lose weight, you may not necessarily kind of see obvious results, but I think if you can change your diet for a little bit better, healthier eating, and exercise, those are things that you can do, that you can make some small changes, and it doesn't take that much time or effort.
Yeah, and curve just a little bit of this or a little bit of that. Get outside, have some activity, and doing that, or changing maybe one scoop of ice cream, not two. Simple things like that.
Yep, setting simple goals that you can actually meet, I think is better than, I need to get down to my ideal body weight. That's very difficult to do, But if you can just make little steps towards that, and even if you're not able to lose weight, if you're doing better with your diet and with your exercise, you're that much better off.
Yeah, it's got to be very rewarding as a family doctor, physician, when you start to see, like, you do the markers, we take the blood test, you do all the markers, and you're working with the patient over time, and let's do this, blah, 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 blah. And then you see a nice panel that comes back, and they're right in the right spot. It's got to feel really good for you, and then see the joy on the patient to say, hey, you're in a pretty good place right now. Things look pretty good.
That is a very good part of the thing. So, for example, with the diabetes, you can talk to people and tell them, I think if you do this, that you'll be able to get to this level. Mm-hmm. And then when they come back and they've done what they needed to do and you can show them, that is really a good thing.
Yeah, it's a huge reinforcement to doing it from then on. It makes your job easier and it makes them healthier. That's got to be really rewarding.
And sometimes they're kind of surprised that I say, excellent job, keep up the good work. We don't need to do anything more. And they were expecting more, that I was going to say something, or,
yeah, just looking for something. There was expecting there was a follow-up or something more they had to do, and you're saying, hey, you're there. You're doing great. Stay on this course. Hey, we'll see you in 6 months, not once a month. All of a sudden, they seem to understand their care, what they need to be doing. You have the medical numbers to show it, rewarding, and they're doing the right part, so therefore, they're on the right path, and you feel comfortable with them, of course, and you set the next diagnosis or the next time you have to see them. That's got to be fun, so got to be really good to see that.
And then it sets up for success with other things.
Mm-hmm.
So if they come in with something different and they've seen that this is what we can do, we can get to this level, with the next problem, they'll be more likely to understand and to see that, yes, we can improve this too.
Yeah, and it's forever changing too, all of this medicines and what you're doing. So trying different things. And also the human body changes as you get older, and how it's processing and making changes in medication, and realizing that you had them on a great path, something changed. Oh, what did you do? They say, I didn't do anything. Well, maybe we ought to make another change. Always diagnosing what's going on and trying to find that solution to make the patient more healthy. So let's talk some current health topics that are, it's always good to talk about this one on a prevention level. Is the month of March is Colon Cancer Awareness Month. Boy, you hear so much about it today. It's simple. Get a colonoscopy, meet your time frames, listen to your doctor, good diet, all of those things. This is the month that we reflect on it. It's get it done.
Sure. And the important part with that is the screening.
Mm-hmm.
And a good screening test is one that not only finds it early, but makes a difference in survival. Finding a cancer early, or something even before a cancer. We have polyps in the colon.
Mm-hmm.
That really is key towards preventing it and treating it early. Early treatment is always better than finding something after you've got symptoms.
Mm-hmm. And the unique thing too for you is being a family doctor, physician, is you could potentially have the history of the family on top of it that So sometimes they kind of say, oh, it's 50, it's 60 that you should have your colonoscopy screenings. Well, if there's something that was in that family history, it might be sooner. You might be 40, 45, whatever it might be, just to make sure you're on top of it.
So actually, that has changed.
It did, huh?
Some years ago, it used to be 50, and now we've gone down to 45.
I thought I heard that the other day, so I'm glad we asked that. Yeah. So, when I did it, it was 50. So, but now, so they are kind of screening a little bit sooner. 45 is the recommended screening date?
Correct. Everybody over age 45 and over,
mm-hmm.
Male, female, that is a routine reason for screening.
Mm-hmm.
And colonoscopy is really going to be the best way, because you can actually find things
mm-hmm.
at the time and remove them and get the pathology on it. And it really is the best way to look at things.
And it's so easy. I mean, it's really so, I mean, everyone gets worried about it. It's so easy. I just had it done, folks. So, I mean, it's easy. Do it. Listen to your doctors, screen. It gives you the best of chance if you catch it early. Or if you get a clean bill of health, now you know.
Correct. And it is, people used to complain about discomfort, but nobody feels it with the medicines and how we do it now.
Mm-hmm.
It is easy enough procedure. The complaint now is the prep.
Yeah.
But you just need to take a little bit of time and energy with that. But once you do it, if it is normal, then we say repeat it again in 10 years.
Right.
It really is a good way of looking at it. And if they find something that's abnormal and you need to repeat it in 5 years or 3 years, then you're that much better off because we know then, okay, you're a little bit higher risk.
Right. So even in a family that maybe historically or history say they might have it in their background and maybe it's something to screen maybe 5 years, I guess you would assess that for them.
Right. So if with the family history, that's going to change it. So even if it's normal, then it's every 5 years.
It does, yeah. So you speed that up a little bit.
Yep.
Would they come in if they had that? Let's say there was a couple markers in the family that made it. Would you do it before 45? Would the physician make a recommendation to do it sooner?
Absolutely.
Yeah.
Yep. That family history, it's not the majority of folks who have colon cancer, but in those who do have that family history, there's a higher risk than the general population. So we may ratchet that age down depending on that family history, depending on if your mother had it, colon cancer, what age did she have it at. So that's something that the 45 years is really for everybody, but for those with family history of colon cancer,
Sooner.
we may have to do it sooner.
Yeah, so it's really just doing that screening and visiting with your physician, knowing about that history, what it might be, if there's any signs or anything that you have. Very well could be sooner than 45, but that 45 is kind of to say, hey, have it done at 45, but analyzing the risk factors of the individual, the family, and the histories and all of that sets forth that. So, I mean, being that March is Colon Cancer Awareness Month, get your screening. It's so, I mean, the equipment is so much improved compared to what it was, so that it's a very simple process. You're right. The biggest thing is getting the prep ready to go in for the next day, but take a long weekend and do it. It's easy peasy. Get it done is the biggest thing we can say. And it's very rewarding if you catch it sooner because you can stop it.
Correct. The sooner the better that you find something, the more easily it is treated. When I was in training some years ago.
A few years back, right?
A few years. The majority of folks that we diagnosed with colon cancer were in a later stage and a much poorer prognosis. Now, the majority we diagnose when it is the earliest stage or even pre-cancer. So that has really made a big difference in survival. The other thing that I would like to make mention is we talk about colonoscopy. That's really the gold standard for screening. And if you're absolutely no way I'm going to do this, there are other measures. And so there's another thing that is basically a stool study. It's called Cologuard.
Yeah.
And that is something that would need to be ordered by your physician, but it's another way of kind of taking a look at DNA and blood in the stool. And the thing with that is if it shows that that's positive, you're going to end up with a colonoscopy anyways.
So you're going to do both. Yeah. But I mean, maybe as an early screening as a younger age or something like that before the 45, maybe it's a good thing to, it's easy to do that. I mean, but you're right, the colonoscopy is so easy, folks. I mean, just pick the best one that's going to give you the best answers. And I guess that would where the physician would come in and say, yeah, do it. It's not that evasive anymore.
Right. Yeah. And it's easy enough to do. And we have three providers who are normally doing it in the hospital here, and they all do a good job with things.
Yeah. So remember that it's March is Colon Cancer Awareness Month. Get your schedule, see your physician, see Dr. Dante Beretta at the CHI St. Joseph's Health Primary Care Clinic, and they can help you with. In closing, before I let you go, is there anything else that you'd like our listeners know about maybe family medicine, the clinic, and just maintaining general good health?
I think, again, it's a lot of it comes down to those good lifestyle things, the diet, the exercise, the good sleep. And then I think if you have some chronic condition like high blood pressure or diabetes and that type of thing, it's not the end of the world that you're on medication. And many of the times that the medication is a hassle, it's daily. But there's good studies out there that it improves life, it improves the condition, and it can save your life. So
it works, Doc. Yep. The bottom line, it works. It might be that sometimes you have to try this medicine or whatever to find it, but if you're working with your family physician to find that right medicine that works best for you, all of a sudden your markers fall in line, everything's good, you have a much better chance of living a longer life. But the medicines do work. And you can't decide to take them here or there. You got to take them daily or do what the regimen says, right?
That's true. That's the difficulty. Every time we look at something as a new habit, that just takes a bit to establish.
Yeah. But I can tell you what, again, ding, ding, it works, folks. So pay attention to what your physician said. So any of our listeners out there looking for a primary care physician, ask for Dr. Dante Beretta here at the CHI St. Joseph's Health Primary Care Clinic, and they're located right at the hospital there. So you can find out more about CHI St. Joseph's Health Primary Care Clinic and get all of your help, and you can find out and visit with Dr. Dante Beretta. Thank you for coming in.
Thank you for having me.
Yeah, it was a pleasure to meet you, and I look forward to visiting with you down the road.
Good to meet you.